This morning, we have Dr. Erica from St. Vincent Healthcare joining us via Zoom. And today we're talking about getting back on track with our annual doctor's exams. Do you feel that people kind of took a break during the pandemic?
Oh, absolutely. And it was a year ago that we were entering into all of this, and people were afraid to go out of their home, and they weren't supposed to go out of their home, let alone to a doctor's office, where they were afraid of getting germs or any of their other screening exams. And so people definitely took a little hiatus over this last year, but I think it's definitely time now that people are getting immunized and that we have a better understanding and handle of this pandemic for people to look at their checklist and make sure that they have not let things slide before before something bad happens. We want to catch things early. So I recommend that people definitely get in to see your primary care provider and have your annual wellness visit. And if you don't have a primary care provider, call and get one. I think this last year has also shown us that you need to have a good relationship with your provider in case you do get sick with something. And we have primary care offices all across the region. So you can call St. Vincent at 406-800-0845 and see if there's a clinic closer to you that's more convenient. But your screening test, your mammogram for women, colonoscopies, is it due for that? Are you due for a pap smear, screening blood tests? Your vaccinations, including the COVID vaccination, as that's becoming more available. Also, really, really important always, but especially this year, is the depression and anxiety screen. Sometimes people don't go and seek out help or care or let someone know how they're feeling until they're in that office appointment, and then they can mention that. And there are so much we can do to make people feel better. Give them support. So dermatology, skin eval, eye doctor. It's time to just kind of get back into all of those. You can look at the checklist there, medication review and refills. Your doctor may not want to refill your medication if they haven't seen you in over a year. So that's another reason to do that. If you are someone that has to see cardiology every year or two, get back in to see them. And then also just discuss any symptoms you may be having that need more attention. So let's get back on track.
Yeah, we all owe it to ourselves. And something else happening today, big for St. Vincent Healthcare, the Call for Kids. Tell us about it.
Exactly. It's the 7th annual Call for Kids, and it's from 6 a.m. already started to 6 p.m. today. And if you listen to Cat Country 102.9, you can hear stories of kids and providers. But the thing that's so amazing about our pediatric unit is we have the only pediatric intensive care unit in this multi-state region here. We also have on-site pediatric surgeons from Primary Children's in Salt Lake City who come up and provide care for our kids in this community, and we need help and support to keep that going. And so if you could, listen to the radio, you could also text kids, KIDS, to 32037, or you can call at 406-869-3669 if you'd like to support. Every little bit helps, and it keeps our kids in our community healthy and with the resources we need to take care of them.
Yeah, they have incredible stories on the radio happening today on Cat Country. And
for sure.
Having a sick kid is scary in itself, but when it becomes down to, I can't imagine, a serious diagnosis, this is our chance to help those families ease their mind a little and know that we've got their back. So Dr. Erica, thank you so much. You have a wonderful day. Good seeing you, and we'll see you next month.
Sounds good. Bye.
We'll be back after this.